When we talk about inappropriate masturbation, now, this is how masturbation is done. This is how it's done. I have a 10-minute video about this on my channel. They can watch it from there when they finish watching.
The YouTube channel.
On the YouTube channel. There we explained how to do appropriate masturbation. Our issue is with those who don't do it this way. The first question is this, sir. Incorrect masturbation. Does it cause premature ejaculation? So we did inappropriate masturbation. Does premature ejaculation happen? You're probably going to say yes, it does.
Yes, no, it does.
So how does that happen?
For example, this can manifest in various ways. Of course, masturbating quickly during childhood and adolescence can lay the foundations for premature ejaculation. To avoid getting caught, they probably sleep in the same room. It's done in a hurry. They probably rush into the bathroom, start masturbating all of a sudden, and try to ejaculate right away.
But if the goal is to ejaculate, if the physical goal is to ejaculate right away, the body gets physically used to this after a while.
Adapts.
They perform the same action in sexuality. That's actually what's happening. That's the situation.
Of course. It becomes a habit. For example, this is one.
He's holding back.
Keeps back.
It's the complete opposite of ejaculate.
It's opposite.
He needs to hold it loosely.
Yes. It needs to be done with pleasure and restraint. It needs to be done thoroughly, when it should be done slowly and in a flow. Doing it quickly and hastily is one of the reasons for premature ejaculation. For example, I remember from one of my clients, when we were little, around 13 to 15 years old, who would masturbate faster and ejaculate. They would have a competition. They would sit under the tree, 5, 6, or 7 young guys in just 1 second, 10 seconds. The fastest one becomes the winner, and the one who came in last would treat the whole group of 5 or 6 people to something sweet.
Actually, that's the essence of future.
In the future,
that's the one who's going to take it, because the others are troubled. Of course, this becomes a learned behavior.
Learned?
In fact, I guess we are addressing this learned behavior, the behavioral treatment of premature ejaculation. We're changing it. Relaxing, taking a breath. We first masturbate calmly, then we have the partner masturbate. After that, it leads to sexual intercourse. What we call behavioral therapy is this.
Right, yes, in general terms.
One of the biggest causes of premature ejaculation, actually. I guess it's about incorrect masturbation.
This habit is very important. Yes. On one hand, there's performance anxiety. It always comes up, so if I can't do it, with the thought of what if it doesn't happen. When a person is masturbating alone, they feel more relaxed. So ejaculation time is delayed. It becomes prolonged because they enjoy it. They're doing it on their own, especially when there's no rush. It's a natural ejaculation process. It becomes prolonged. When does the partner come into play? As certain anxieties come into play, process starts to break down.
For example, we call this friction. Traumatic masturbation syndrome. Yes, actually traumatic masturbation syndrome causes premature ejaculation in some patients that I've seen. Definitely. In some patients it causes delayed ejaculation. It also leads to a lack of sexual desire. So, when you continuously rub a certain area until it becomes sensitive, sometimes you can't achieve that friction. In sexual intercourse, this time they can't ejaculate. Sometimes they do achieve that friction. There's also a feeling of warmth, of course. So it makes them feel much more. That can also lead to premature ejaculation. Sure. So what we call traumatic masturbation syndrome is probably rubbing against the bed.
Rubbing against the pillow, rubbing against the floor. Contrary to what is believed, there's actually quite a lot. It's like a partner with a man on top and a woman underneath, in bed, lying directly on the pillow or the floor. It's like they're rehearsing as if they were having a real relationship with a partner. It assumes that intercourse is taking place. Of course, this rubbing makes them feel they are only getting arousal this way. After a while, they have difficulty engaging in a real sexual relationship with a partner. For example, it's a lot, and one of the reasons for masturbation is, cause of premature ejaculation.
So the answer to our first question is this. If you engage in inappropriate masturbation, it can lead to premature ejaculation. We don't say it happens. It can happen. In medicine, there's no such thing as anything can happen.
Definitely.